once again, we are coming to you from the Florida Cancer Specialist and Research Institute, and I'm joined by Dr. Christopher George this time. And if you've been fortunate enough to never have a breast cancer diagnosis, well, you're lucky, because so many times you hear it, and most people without the diagnosis think that it's just one disease. But people couldn't be further from the truth, and maybe that attributes to why some rates are really good, yet still breast cancer, very scary statistics still for people who've lost their battle. Why is that?
Well, so you're right. In the past, we used to think of breast cancer as a single disease. Sort of in the 70s and 80s, it was just breast cancer. But once we developed genetic-based medicine, we realized that there really were several different subtypes of breast cancer. Hormone receptor positive breast cancer, triple negative breast cancer, or HER2 positive. And those behave entirely different. Some are fairly slow growing, not aggressive, and others are very aggressive cancers. So that discovery really has changed our approach to breast cancer and our thinking about treatment as well.
Well, before we even get to the treatment part, so many times you hear, do this or don't do this, or this lowers your risk for breast cancer. Based on your study, since this is a research-focused institution, what are some of the do's and don'ts right now that really you can see affect breast cancer?
So there are things that people can do. First, of course, you have to look at your family history and see whether you have a high-risk family profile. But even in the absence of that, people need to get screening on a regular basis. And from a lifestyle, people always want to know, what can I do to prevent it? And so I think there is some evidence that diet can have an impact on breast cancer risk, exercise, and also avoidance of significant weight gain after menopause. And then finally, while controversial, the use of postmenopausal estrogen replacement also increases risk.
Well, you kind of brought up the word controversial, which kind of leads into talking about different studies or different treatments that you're able to do here. What are some of the new studies or new treatments or even the clinical studies that you're able to implement?
So breast cancer is an area where we're seeing really excitement changes in terms of what we can do. And so over the last decade, for example, in HER2 positive breast cancer, a really aggressive form of breast cancer, we've seen that if we're able to target those specific drivers for that cancer, that we can take what was previously a really high risk, high rate of return breast cancer and change that where very few patients are now having recurrence. In other forms, we're beginning to target genetic mutations in the cancer specifically. We have a lot of clinical trials going on targeting specific driver mutations in the cancers. And most recently, the most exciting thing is the development of immunologic or immune-based therapy for cancers, and this includes breast cancer as well, in which we're upregulating the person's own immune system against the cancer. So these are some very exciting clinical trials that are going on now. So
safe to say, you talk about the exciting treatments, that there definitely is progress being made, and being made right here in our backyard.
That's right, and so people should look to participate in clinical trials when appropriate for the type of cancer that they have. Okay,
well, we really appreciate your time. You were a hard one to get a hold of today, so thank you so much. We really appreciate it. And as always, if you want any more information, just be sure to go to tbmorningblend.com.